My pain baseline right now is 10 out of 10. And then
It's
when
amazing to carry this conversation with a 10 out of 10.
I'm sweating, man. It's hard. When my foot gets swollen at the end of the day, or I bang it on something, or I have to get up and the blood rushes to my foot, it's 12 out of 10. It's all I can do not to scream almost all day. It was not a fun experience in hospital because a neurologist came and he was not friendly. The last 2 injections, he got stuck in a vein in my back, tried to pull it out, and then decided to go through. I have been dismissed for pain since the age of 12. He couldn't figure out what was wrong, and so he actually got mad and yelled at me in the hospital and said, "I told you this was stress."
But that comes from an area of ego where,
Yeah.
yeah, because I don't know what's wrong with you, the fault is with you. It's not my incompetence. So, yeah, there are people like that. We used to have very good generalists, but now where medicine has evolved to is specialization and subspecialization. Yes, they may be masters of their craft, but that makes them also very siloed. And then it makes them anything that's outside my realm is not of my business. And then it makes it very easy to, kick the buck or the thing around and then hoping somebody else will solve these things because it's not my specialty anyway.
I just turned 40 last year, but it's like I'm grieving this whole however long I have left on this planet has changed.
I just want to take a pause here and say that for someone who went through what you went through, and you still have this vibrancy and life, and it's lovely to see, and I can feel it from over here. There's this forward-looking thing within you.
How do I say your name?
Oh,
Kwan Yu. Okay,
yeah.
nice to meet you.
Okay. Okay. If it's easier, people do call me Dr. KY if it's easier. And Nikki, would you like to, tell us how it began?
I feel like mm, my story is a little unique in that I had symptoms of CRPS for over a year before it actually got diagnosed. And I never did actually find out from any doctor why I got it in the first place because there was no injury. CRPS is triggered by injury, usually or nerve damage. So over time, I feel like it's possible that it was triggered by a stroke that I had in 2019. Just doing my own research, no doctors told me that you
I've
can
heard that.
develop it from that.
I've heard that coming after a stroke. Yes.
Okay, yeah. So I figured that's what triggered the first time. I was hospitalized for 10 days and I was paralyzed on one side of my body fully for 3 days. And then each day I got a little bit more feeling back. But with that feeling coming back came all of the CRPS symptoms, extreme edema, pins and needles. It feels like something is munching or gnawing on your bones, and also like tons of pressure on your bones. And it would feel like bubbles were snapping under the skin and my skin was crawling, like all these weird nerve sensations. And it was not a fun experience in hospital because a neurologist came and he was not friendly. He couldn't figure out what was wrong. And so he actually got mad and yelled at me in the hospital and said, "I told you this was stress." I had seen him before. "I told you this was just stress." They did every test in the hospital to try to figure out what was wrong. No one had any answers. One doctor said, "We have to consider this as psychological." And I just couldn't come to terms with what I was seeing and feeling physically. How could that be psychological? But the next doctor said, "It's not in your head. We just don't know what's wrong." Over the course of time, I went from using a walker to a cane and then nothing. I went back to work for 5 days and I started running again. And then I was running down a mountain on a trail and I suddenly felt like a disconnect between me and my left leg again, like paralysis. And then the next thing I knew, I was on the ground and I had dislocated my patella. So that triggered very severe CRPS. And then I was wheelchair bound for about 5 months. Graduated to a crutches, then a walker, then a cane. And then I've recently had a very bad flare up. So I'm currently in a quite a severe flare up. I'm back on crutches. And if I have to go long distance, back in a wheelchair.
And see, thank you for sharing, Nikki. I think that's not easy. And then, although there's some knowing CRPS, it's still what actually started it off. And then during the run, how could it get reprovoked again? I think these are the dots that are waiting to be filled. And sometimes having that closure, what I found is it truly helps people to get across that uncertainty. That uncertainty is something that drains. And I'm sorry we left in before knowing who you are or what you do. And then perhaps we could rewind a bit about that first. Yeah.
Sure.
Yeah.
Yeah. My name's Nicole Godberson. I'm a wife of 20 years and a mother. I have a 16-year-old son and a 13-year-old daughter. And I have had quite a few jobs in my life. What I stopped last was landscaping and post-construction cleaning. So I've always been like a very physical person. I was an avid runner and cyclist. I enjoy swimming, outdoors hiking, backpacking, all of that. Anything outside. And
Yes.
what else? Who am I? I this disorder has stolen a lot of like my identity.
Yes. And knowing who you were pre-CRPS, being outdoorsy, loving nature, I'm the same as well. And I could feel for you how being homebound really takes away that identity, that part of you. And if we could go a little bit deeper, how else has it impacted your life?
I really treasure family and friendships and relationships, and it has impacted all of that. That's a huge one for me. It's a very hard disorder to explain and for people to understand. So I have lost some friendships along the way, but I've also strengthened some friendships. People that are still in my life are very much there for me. So that's good. I cannot work anymore. I've not worked in 3.5 years. So that's hard mentally to lose that. Yeah. A huge part of my personality is being outdoorsy and I started working out at the gym when I was 15 years old regularly. And I still try to, I can't right now, but when I can, I love it. But it's not the same. I can't hardly do anything. It's disappointing, but yeah. Mentally, emotionally, it's impacted me immensely. I just turned 40 last year, but it's like I'm grieving this whole, however long I have left on this planet has changed. And it's scary because it's not a guarantee that I'll always be this bad or severe, but any future injury impacts my life greatly. And I worry now about losing bone density and getting osteoporosis. I have muscle atrophy of my quadricep, my glute, my hamstring, my calf, and also in my feet. And it's complicated by a whole bunch of other disorders. I have Ehlers-Danlos, so my muscles keep my joints together and I'm losing my muscles, which makes you more prone to dislocation, which triggered my CRPS in the first place. I have a blood clot in my leg right now.
Sorry, you have what?
A blood clot.
Oh, okay. From DVT? As in
It's in a superficial vein, so that's good. It still hurts
Mm,
very much. It's in
mhm.
that leg too. Yeah, there's just, I'm realizing any little injury, it flares up again.
Mm.
So then it changes my life all over again. I might get a little better, get used to that way of life, and then it goes backwards again.
The anything that provokes a flare may cause it to spread. And then
Yeah.
there was a baseline previously, and then you find yourself at a new baseline, which could be lower than previously. Yeah. And I can understand, from that angle, if that's what's gonna come in the next 10 years, 20 years, how many of these am I going to experience? And that's the outlook is something that's that is unnerving or even scary even. Yeah. And and in terms of within the family, how has CRPS impacted you?
Me or my family.
You and your family, as in
Yeah.
your nuclear family.
Huge. I feel so blessed. I have a very committed, loving husband. He's an amazing father, and our kids are spectacular. But I feel like I've ripped part of their childhood away. And one of our favorite things to do is to go backpacking as a family. And we just can't ever do that again. My kids right now, because of the flare up, they're doing everything for me. Things kids, I feel like they shouldn't have to go grocery shopping and make dinner every night. And
Mm.
they're taking really good care of me. They're bringing me water and snacks all day. And, oh, I forgot this. Can you grab that? It's affected their emotions too. Same with my husband. It's very hard to watch somebody suffer so much and not be able to really do anything to make that pain go away. I have moments where I'm crying or screaming and they're just watching. And it breaks their heart, it breaks my heart.
I just want to say that it's really lovely to hear how your kids are there for you. And I
They're
know,
crazy.
right, the more that they do, the more, the guilt that you may feel. And I want you to know that and then don't allow yourself to what's the word? To be swallowed by that guilt. Yeah, because that would also cause the loop. Yeah.
Yes. Yeah.
Mhm. And if I remember correctly, you have this for about 3 years?
I've been diagnosed for 3.5
Yeah,
years.
yes.
It started the year before that.
A year before that.
So 4.5 years, yeah.
Okay. Before we go into what helped and what hasn't, from the medical point of view, having a stroke at the age of 37 or 38 also isn't the norm. With your current superficial blood clot, do you have a clotting disorder or something that runs in the family?
No clotting disorder.
Mm.
No. And I was 34 when I had the stroke.
Oh.
But I do have a hole in my heart, a
Mm.
PFO, and
Mhm.
I do have fibromuscular dysplasia of the carotid arteries on both sides.
I see. That sort of explains it. That's part
Yeah,
of the Ellison loss as well. The
could be. I don't have a lot of explanations for a lot of stuff. It's possible.
Yeah. Usually a PFO is not something that we need to blood thin or anticoagulate. So I would presume you were not on aspirin or warfarin or anything of that sort.
I do take 81 milligrams aspirin daily.
That's after the stroke.
Yeah, so
Mm.
since 2019, I've had an aspirin a day.
Understand. And I would say, without going very deep into your clinical history, but just to give you some form of mini closures, if I may, would
Sure.
be that because Ehlers loss is about the matrix proteins, it's about the collagen disorders. And when you have the fibromuscular dysplasia of the carotid artery, it's the innermost lining, and probably the media as well is affected. And probably that alters the structure. And when the structure is altered, depending on what they find during an angio, how is the internal structure altered? That could be where the turbulence happens. And when there's turbulence, and you can imagine turbulence, and then after the turbulence, there is an area of stagnation. And that's where the first seed of a clot can happen, and then it gets embolized to the brain. that could be something. I'm not sure whether that was what the other doctors explained to you.
Yeah, I don't know. I would love to know. That is actually the other diagnosis I have. And I feel like they've got to be connected somehow, but there's 40 of them.
40 diagnoses that you have?
Yes. Yeah, it's really complicated. And I
Oh,
feel like some of them got to be part of the other thing. It's a lot. Yeah.
okay. Okay. Perhaps subsequently it could be written down and then I could group them somewhere. Yeah. And along this journey, I think the first part was just now you mentioned that the doctor he was angry. He was angry, and whether this will appear in the recording subsequently, I don't know, but that comes from an area of ego where,
Yeah.
yeah, because I don't know what's wrong with you, the fault is with you. It's not my incompetence. So, yeah, there are people like that.
Yeah.
So,
I read that. It
yeah,
still was like, it just felt so unfair.
yeah, truly unfair. And perhaps you can share what would be an ideal interaction and coming through the past couple of years you had. I would assume many doctor visits and everything. And what was good and what was bad?
Yeah. I have been dismissed for pain since the age of 12. I have had chronic severe migraines since age 12. I'm talking like 17 to 20 migraines a month where I'm in my room in the dark. I'm disabled. And I was told for decades, take Advil, manage your stress. That's it. I was really disappointed. When I started figuring out the stroke thing, my doctor finally sent me to a migraine specialist. And so we're treating that now, thankfully, because I ruined my stomach taking so much Advil as a youth.
Mhm.
So I have gastrointestinal issues. Not a lot of things are working well. But yeah, eventually my doctor finally started listening and listening with understanding. And I know that I came across as a hypochondriac for sure because everything's wrong. But he finally listens. And now, if he's not sure about something, he immediately sends me like urgent to a specialist. So in Canada, you need your general practitioner to refer you to a specialist. So I can get in fairly quickly thanks to him. So I'm grateful for that. I saw many specialists have had endless tests. Some of the doctors have been great, some very dismissive, a lot of complicated answers. And like I mentioned, things seem connected, but no one is willing to connect the dots for me. I did finally meet an amazing physiatrist. So he's a neurologist that studied physiatry. And he finally diagnosed me with CRPS when he tried to do a nerve conduction study on my CRPS leg, which also had foot drop. Severe. Couldn't lift my foot up. And they couldn't even put the little nodes on my leg to do the test. I was screaming and bawling. And he was like, no, this is not an overreaction. He took his time with me and diagnosed me with complex regional pain syndrome. And within a week, I was at a pain clinic at our local hospital, getting spinal lumbar sympathetic nerve block injections, which I did monthly for about a year. They were lovely. They set me up with an occupational therapist and a psychologist. And she's been amazing. I still see her. It was incredible to finally be heard and to not be told it's in your head, that this is real, it's physical. Even though you've had trauma in the past, it wasn't like I was making this up or something. And that was huge for me to understand what was wrong. And then now I know what to do to help myself. I can research, there's lots of tools. And I did get better at one time. So I know there's a possibility for improvement. And I really focus on that every day. If I can improve just a little bit, As far as doctors, I do wish that doctors could work more together as a team for someone, that like they all know each other and know me. Everything's very separate here. They might share some notes on paper, but I wish there was like a team. I've heard of that in the States for CRPS. People will have a team of doctors working with them. I think that would be helpful.
First off, Nikki, is that going through what you went through. See, okay, I just want to take a pause here and say that for someone who went through what you went through, and you still have this vibrancy and life, and it's lovely to see, and I can feel it from over here. There's this forward-looking thing within you. There's hope, there's energy, and I just want to celebrate that. Give you 2 pats on your back. Yeah. Yes. And just a little discourse into the medical profession is that we used to have very good generalists, but now where medicine has evolved to is specialization and subspecialization. Yes, they may be masters of their craft, but that makes them also very siloed. And then it makes them, anything that's outside my realm is not of my business. And then it makes it very easy to, kick the buck or the thing around, and then hoping somebody else will solve these things because it's not my specialty anyway. And that's sad to see. My patients have experienced that, bouncing from a doctor to a doctor, doing scopes, doing MRI, doing CT scans, but nobody actually coming, putting everything together and telling them,
Yeah.
based on everything that everyone has done, taking that responsibility and say that I feel, and this is based on my experience, this is medical legally, this is on their defense, for them to put their foot down and say this may have implications on them, and that it's safer not to make any commitments. So it's a sad state of affairs, to put it simply. And Nikki, along the journey, what have you tried, if you like, to share with us some of the medical, non-medical interventions that you've done? And just now you shared with us the spinal lumbar sympathectomy. What other things have you tried, from the non-invasive to the invasive? What has helped and what hasn't?
Yeah. Yeah, probably the most invasive would be the nerve block injections. A little complicated because the Ehlers-Danlos too. When they try to do an IV, my veins run away. They roll. So it's hard to get poked over and over. And then it just does happen sometimes. The last 2 injections, he got stuck in a vein in my back, tried to pull it out, and then decided to go through. So I bleed on the table a little bit. It's alarming. It's not a pleasant experience, but I do feel like they helped when I needed them. Yeah, a little bit. Couple days of different pain. Yeah. Sorry, did you have a question?
Oh, yeah. So that was from the most invasive. And then what others have you tried?
Yeah. At a different pain clinic for a different issue in my shoulders, I get lidocaine injections. I have another rare disorder called parsonage Turner.
Again, sorry?
I think it's pronounced parsonage Turner.
I haven't come across that. Okay, yeah.
Yeah, it's unexplained, incurable damage and compression of the brachial plexus nerves.
I see.
So my CRPS was spreading into my arm from that. So I get those injections of lidocaine in my neck, trap, and around the scapula to try to calm that down. That helps, again, temporarily for a while. And then, yeah, physiotherapy and occupational therapy, along with being in a pool or hot tub with desensitization, those are less invasive, but very painful. But I would do those daily and see improvement. And I kind of would say I would look back week to week and see some improvement. So then keep going. I was recommended an app on the App Store called Recognize Foot. And I found that helpful because I'll try to explain this as best I can. It's like when the pain is so big, my brain dissociates my leg and then I can't really feel it all the way. So that app helps you recognize your foot and make it part of you again. That makes any sense?
Yeah.
So that was helpful. I guess, a little less invasive would be the medications and then supplements. Do you want to know about that?
Yeah, sure.
Okay. When I have a really big flare up, I might take a T3. I have just started something called nortriptyline. And I also am on prednisone right now for inflammation. And I could take stronger pain medications, but I have a lot of, oh, with the word addiction in my family.
Mm.
And I'm quite nervous. I don't want to have to depend on something if I can go without. So I'm not against it and I may need it in the future, but for right now, I don't want to. I'm just trying to tough it out. And then my pain clinic, they recommended, so I take omegas, 600 milligrams of magnesium daily, coenzyme Q10, alaulinum, methylated B12 and B complex, 2,000 milligrams of vitamin C a day, 2,000 units of vitamin D, probiotics. That's it for like supplements and medication. And then I had them and will continue. It's something called EFT tapping.
Yep.
Okay. I find that calming.
Mm.
I do see a therapist once a month. I do my own physiotherapy. And I find singing very calming and it lifts my mood. I pray a lot. I read the Bible. I read books. I try to spend time with family and friends as much as I can. And then I guess also physically, if my foot's swollen, I'll put a cold, wet cloth around it if I can handle it. And then if sometimes it's freezing cold, so I'll put something warm on it if I can handle it. I had written those down. That's all that I could think of this afternoon, but there probably is more.
And what has anything small have had an outsized effect?
Has anything small had a what effect?
Outsized effect, meaning that something that you felt that should not help much, but then it ended up give you a lot of output.
Yeah, I forgot to write down this one important thing. I have to be as calm as I can. And so I have all these sayings that I say to myself all the time. One of them is a calm heart is the life of the body.
Again, sorry?
A calm heart
Mm.
is the life of the body. So I try to stay calm. And one of my knee surgeons, he said to me, you have to adopt this motto. And I didn't like it at first, but now it works. He said, painful, not harmful. So if I know I got to get off the couch to go to the bathroom and I have to put my foot on the floor, I say it's painful, yep, but not harmful. So I'll do it. Trying to think. There was some other sayings that I say. A body in motion stays a body in motion. Just little things like that help me keep moving. I'm trying to keep moving as much as possible.
And just to elaborate on that for the future listeners to this is that in CRPS, because of the pain, some of the individuals would then restrict their movements. And when restriction of movement comes in, there's further loss of function, then comes the muscle atrophy, there comes the bone loss, and this brings the trajectory on a different plane. And that's why keeping the motion going is important, but then it's not easy. And this is what CRPS sufferers have to go through, finding that balance. And it's not an easy balance to find. Yeah.
very often I find myself overdoing it and then having a really bad flare up. So it's hard to find that balance and it changes every day. Some days are real bad and some days are a little better. But then, yeah, maybe on the good days, you overdo it a little bit. It's tricky.
It's tricky. It's tricky. And thank you for sharing that. And if you know there's someone who, let's say, recently got diagnosed with CRPS, what would you say to them?
Aside from I am so very sorry, try to keep moving. Try to keep your hope. It can improve. Even if it improves a little bit, it will help you be hopeful. And hope is everything. I hope they can find good doctors, treatments that work for them. That's a tough question.
Something that you would have told yourself 3 years ago, for example, yeah, if that makes it easier.
Yeah. It's an awful disease, but you can be a literal warrior. And it's been so difficult, but I'm really proud of myself. So keep trying. Don't stop trying. Never quit trying. Always try to get better because things can change. And even with season to season, the heat brings a different challenge than the cold. The rain brings a different challenge. So it's always changing. So you're not necessarily stuck forever in such a severe state. It can get better.
Thanks for sharing that. I think that is that outlook, motivation, or even hope is truly important. And also for future audiences who are watching this, it would be that when there is anticipatory anxiety, fear, and uncertainty about what's coming next, that actually fits into the fear, tension, pain sort of cycle. And that could accentuate the pain that one is experiencing. Not at all to say that the pain is in the head, but then our minds, our body, they are one. And it could fit into that loop. And that's something that if we are aware, we could write down a little bit on the amplifying
Yeah.
things that could amplify the pain. Yeah.
Yeah. I definitely agree with that. That is something I would have told myself was learn every tool you can to calm down your nervous system. It does definitely affect like the severity of the pain.
Yeah. Thank you. Thank you for that, Nikki. And may I share something?
Yeah.
So part of my journey as a Western medical doctor, but then I was working in a dialysis facility back in 2014. And at that time, I know that I'm going to go on a short story over here. Is that we know that kidney failures happen because of SLE, lupus, stone disease, diabetes, and sometimes it's the illicit medications. But then there are cases where it's unknown. It's unknown, and then sometimes we get an autoimmune cause, sometimes we have no idea. And then the patients will ask me, Doctor, I took care of my diet, my exercise, my sleep. I don't smoke, I don't drink. Why am I getting this? And something that nags at me. What is this? What's the cause of this? And over the past 11 years, it's been something that always is in the back of my mind. And then nowadays that we have eliminated infectious disease to a large extent. And now what we are facing is a lot of chronic disease, cancer, autoimmune, degenerative conditions, allergies, and it's increasing so much. And one thing that we to understand this, I would say that, it's the pollution, it's the quality and the contamination of the food that we eat. But in my recent experience is that a lot of research is that why is the root cause of all of this, right? The common denominator is chronic inflammation. And this inflammation, yes, that's right. There's the food, there's the lifestyle, and then there's also the toxins. But when those factors are actually eliminated, what I find is that the unresolved things within anxiety, guilt, shame, fear, worry, and if that comes up again and again, usually what I find is there is this deep-seated trauma that sits within a person that becomes the seed for things to, right, to, right, when we do therapy, we bring down the episode of anxiety, but then when a trigger comes, it comes back again because it ties back to a deep root. And currently, what I'm doing in my work is I'm helping people find that root and to neutralize it or transmute it. And then I just like to, perhaps I would ask you, Nikki, is that right now, what's your day-to-day baseline in terms of discomfort, pain, or what is a daily sort of CRPS baseline?
As far as like pain level,
Pain level and any other things that you are sensing, like in this past week, for example.
yeah, it's been a week. It's been a hard week. My pain baseline right now is 10 out of 10. And then
It's
when
amazing to carry this conversation with a 10 out of 10.
I'm sweating, man. It's hard when my foot gets swollen at the end of the day, or I bang it on something, or I have to get up and the blood rushes to my foot. It's like soaring. It's 12 out of 10. It's all I can do not to scream almost all day. So the past week for sure, almost every night I've had just broken down, overwhelmed by pain. And so I'm bawling like 10 minutes straight till I can't cry anymore. It's been tough. So yeah, there's the whole physical part, and then the whole emotional toll is huge. And I'm quite a positive person, but it's so overwhelming.
I hear you. And I feel for you, although I can't say I feel you, I feel for you.